Let's bring in our panel now. The IPA's Daniel Wild and Kristy McSweeney from the PR Council join us in the studio. Great to see you both. I was absolutely staggered at the weekend when I read that people were using, Kristy, their superannuation to actually pay for elective surgery because the waiting times have become so long. I heard some talkback calls during the week of people waiting 4, 5 years for hip replacements or for knee replacements, people who are in chronic pain. I mean, you'd be tempted to drain your superannuation if you were in that sort of pain, weren't you? Good evening.
Hi, Steve. Thanks for having me. Yes, of course, and people in so much of those age brackets that are looking at what they've accumulated in super, thinking, oh, I could really use some of that, are in that bracket where they are getting to those injuries, causing themselves in chronic pain. Of course, it's always been legal to take your super, but it was a long, involved process for medical issues. And there was a huge amount of red tape you had to go through to get it. This is different. So it is something that Australians have always done. But of course, people should have access to as much as their own money as they like, but they shouldn't be in a position where relying on public hospitals means they're waiting far too long to get the treatment that they need, and rating their super is their last resort.
Daniel, it does raise the question of what's happened to our health system. And we obviously have a two-tier health system now where there are people who are well off, are able to access private health insurance and then go private to get a new hip or a new knee. People who are forced to go on to the public system are left in horrendous pain. How did we come to have such a massive gap? And is there any sense that the changes announced about Medicare last week is going to fix that?
Well, Steve, you make an important point about the two-tiered system, and Australians are right to wonder. We're spending billions and billions of more dollars every single year on our health system. And just let me give you an example here in Victoria from an important Herald Sun report over the weekend by John Malinauskas. There's been this proliferation of the clipboard class, where we've had about a 25% increase in the number of bureaucrats on these big, six-figure fat cat salaries. As I say, more money going into the system than ever before, but waiting times are exploding, results are going backwards, and many Australians are wondering, well, where is this money going? What we need to do is not just tinkering around the edges, but to have a fundamental rethink of how we deliver government services to back in frontline staff to make sure we can get through this backlog, rather than more and more money going to these bureaucrats that are sitting in big office buildings in the CBDs.
Kristy, it just seems unbelievable that to have an operation like, a hip operation's reasonably serious, but it's a simple thing to do, or a knee replacement's a simple thing to do. You're in and out in a day or so. Why do we think we've got this massive backlog when, as Daniel said, we've poured billions of dollars into the health system year after year after year, and you can be sure that the current Labor government will even up the amount of money being put into health. But where's it going?
Well, it's something called a cost shift. And you and I and Daniel, Steve, we all know this. We've done this for a long time, where the cost shift is the gap in the middle where the federal government pays outpatients, the state government pays inpatients. It's really hard to tell who owns what. And the poor taxpayer with his bad hip or his bad knee is stuck in the middle. Now, Greg Hunt, when he was the Minister for Health, did what's called the MBS review, which is a review of all the items that are on the Medicare Benefits Schedule. That's the review of every single item that doctors and surgeons get paid for. And guess what? The doctors and surgeons don't want to review how many items are on there because they're making a lot of money. Some of those things are completely unnecessary to be funded by Medicare. They're mostly elective for rich people with bad tennis elbow or bad tennis knee. Wipe some of those off, go to war with the doctors, and you might clog up some of the surgeons' time and limit the public hospital waiting list just a bit.
Well, I'm lucky enough not to have any chronic pain, but listening to those callers on Talkback Radio during last week, if you have a bad back for 5 minutes, you know how bad it is, so I can't imagine how they can put up with it.